Hello everyone, I'm Dr. Joel Schwartz. I'm a chiropractic physician and I practice in Monroe Township, New Jersey. Today I'd like to talk to you about a common problem that we see in our office, and that is chronic lower back pain. First of all, let me define for you what I mean by chronic lower back pain. Well, chronic lower back pain is back pain that occurs periodically. In other words, it's not just one occurrence, it goes away and then you never have it again. Chronic pain reoccurs. You may have it once every week, once every 3 months. You may have it continuously without it ever abating. Just depends upon the person. So there's various typical scenarios that occur with chronic lower back pain. Sometimes people will have a very severe lower back pain. It's debilitating, and actually they may not even be able to stand up straight. They may be bent to the side or bent forward and unable to stand up straight, or they may be limping. And that's what I mean when I say here severe episodes with antalgia. Antalgia is the body being bent somewhat due to pain. So that's one scenario. Other people may just have a chronic stiffness in their back, chronic stiffness and achiness. Every morning they wake up, get out of bed, chronic stiffness and achiness. Or every time they get out of their chair, they have chronic stiffness or achiness. There's other varieties as well. Some people have a chronic stiffness and achiness, and then they have that acute pain that's superimposed upon that every 3 weeks or every month or so. Other people may have the chronic stiffness and achiness, and they'll have a very sharp momentary pain that only happens when they move into certain positions, like when they roll over in bed or when they get up from sitting to standing. So those are some of the different varieties of chronic lower back pain. Now, let me go right into telling you about what you can expect with a program that I've developed for treating chronic lower back pain. I've been working with this problem for over 22 years, and this is a very comprehensive program that we have. So, what can you expect? You can expect a reduction in the level of pain. Some people will be able to get their pain all the way down to zero pain, and some people will be able to reduce it substantially. You'll also be able to expect an improvement in the activities of daily living. You'll be able to do things you weren't able to do before because of pain. You may be able to resume a sport, or just simply be able to sit longer when you couldn't sit before for any length of time. Now, after completing the program, you probably will, or may, let's say, may have some reoccurrences, but those reoccurrences will be less intense and they'll be less frequent as well. And typically what happens is, over a period of time, if you continue to implement what I teach you at home by yourself, you'll continue to get better and better over time. So those reoccurrences will get fewer and fewer and less intense. And you may get to a point where you have no lower back pain at all. Because people have chronic lower back pain, they've had it for a certain amount of time, it takes a while for the body to actually heal. So you have to develop a mastery of your lower back, okay? You have to be able to take care of yourself. You're not going to be able to come in and see me continually all the time. You have to be able to do things at home. And the reason you get better over time is you develop fertile ground. Once you start doing everything right for your back actually starts to heal. So instead of constantly re-injuring yourself, you have enough pain-free episodes that your discs, your ligaments, the joints, and the nerves in your back actually start to heal and stay better instead of constantly being re-injured. Now, your results that you obtain with the program will depend upon a few things. How long you've had the problem is very important. Your age, the amount of spinal degeneration or arthritis you have also is important. The health of your brain, and what I mean by that is how well your nervous system controls your muscles and your joints. And that's one of the main things we teach you, is learning to control your muscles and your joints with your nervous system. Your general health is important as well. For example, smoking is a very important factor. And adherence to the program is probably the most important factor. If you do the things that you're taught, you'll definitely get better and achieve the best results. Now, this program is very effective, it's comprehensive, and it's really a school for lower back pain. It's a combination of in-office treatments where you come in to see me, learn things to do at home, and then apply them at home. We also have video backup for you so that when you learn some of the exercises and the other things that you're taught, you'll be able to go and view them on the internet and practice them at home and keep up with them. As I said, it's very thorough and comprehensive. Now, chiropractic adjustments are a mainstay of the program, and chiropractic adjustments are probably the most researched area for lower back pain for about the last 25 years at least. And chiropractic adjustments have been shown to be the most effective treatment for lower back pain. Now, when someone has chronic lower back pain, it is important to add in other things as well. And that's how you get the maximum benefit. So we add in therapeutic exercises, and these are very specific to your own body type and your own body shape. It's much more than a gym program where you do a class with a core class or a back class. This is specific to your problem, and we train the very deep muscles that are located deep in your abdomen and your spine that control your spinal vertebrae. We also teach you how to take care of your spine. That's what spinal hygiene refers to. You need to become aware of what position your spine is in when you sit, when you bend forward to pick things up, and when you do exercises. We also utilize nutritional supplements for some people, especially people who have arthritis. Sometimes we'll utilize glucosamine or chondroitin sulfate. In addition, we treat the entire motor system. What does that mean? Well, some people have problems with their feet, their knees, and their hips specifically that are actually causing them the lower back pain or contributing to the lower back pain. So we may need to actually treat those areas to get your lower back to work better. Now, there are other ways to go besides a program like this that is drug-free and actually takes a bit of work. So you can utilize pain medications, injections, and surgeries, and in some cases these things are needed. But they're much overutilized and they have a lot of side effects. Let's talk about chronic pain for a second. There's 116 million Americans each year who suffer from chronic pain. Most of that's due to lower back pain. We also have an opioid. Opioid are prescription pain relievers. They're narcotics and they're addictive. We have an opioid epidemic in this country. We're only 5% of the world's population, yet we consume 75% of the opioids. Spinal surgery is also overutilized. If you just have lower back pain, an uncomplicated case of lower back pain, only 1 in 100 people are really going to be helped by spinal surgery for this type of a problem. So in conclusion, medications, injections, and surgery sometimes are needed, and we do actually have people in our practice that are doing these things. They've had surgery before, or they're getting injections, or they are taking medications, and we're able to work with them in conjunction with their medical doctor. And one word about medications specifically, we don't take you off medications, although a lot of our patients want to get off medications, and that's why they come into the program. We allow you to make that decision yourself. That's in conjunction with the doctor who puts you on the medications to start out with. As you start to feel better, it's your choice. You can talk to your doctor and reduce your level of pain medications. So that's really all I wanted to tell you today. But if you have any questions, please don't hesitate to contact me at the phone number you see here or at my email address, and I'll be glad to answer any questions you may have. Thank you for watching.